Hello everyone. Now we are discussing about inhalational anesthetic agents. Introduction. IV anesthesia induce anesthesia. Inhalation anesthesia maintain anesthesia. IV anesthesia milligram per kg or microgram per kg. Inhalation anesthesia percentage of the volume. Example 2 liter per minute oxygen plus 4 liter per minute nitrous oxide. That is concentration of nitrous oxide is equal to 4 by 2 plus 4 is 66%. MAC minimal alveolar concentration is defined as the concentration at 1 atmosphere of anesthetic in the alveoli that is required to produce immobility in 50% of adults patients subjected to surgical incision. MAC is important to compare the potencies of various inhalation anesthetic agents. MAC is related to potency of anesthetic agents. MAC bar 1.2 to 1.3 MAC prevents movement of in 95% of patients. MAC value: nitrous oxide 105%, least potent; halothane 0.75%, isoflurane 1.16%, enflurane 1.68%, sevoflurane 2%, desflurane 6%. Nitrous oxide alone is unable to produce adequate anesthesia, require high concentration. So, in conclude, lower the value of the MAC, higher the potency. That is, the halothane is more potent in current use of inhalation agents, but methoxyflurane has the highest potency, but not in current use. The least potent is nitrous oxide and most potent is halothane. Factors affecting minimal alveolar concentration: decreased MAC, age, peak at 6 months, pre-medication, for example benzodiazepines, opioids, pregnancy, acute alcohol intoxication, other volatiles. MACs are additive: 0.6 of one agent plus 0.4 of another is equal to 1 MAC. Nitrous oxide, hypothermia. Increased MAC, chronic alcohol consumption, increased sympathetic activity, hypermetabolic states, thyrotoxicosis, pyrexia, and anxiety, some antidepressant, tricyclics, monoamino oxidase inhibitors. No effect on MAC: gender, duration of anesthesia, carbon dioxide tension, metabolic acid base status, hypertension, hyperkalemia. Uptake and distribution of inhalation agents, that is transfer from inspired air to alveoli, depends upon the inspired gas concentration, alveolar ventilation, characteristics of the anesthesia circuit. Transfer from alveoli to arterial blood depends upon blood gas partition coefficient, cardiac output, alveoli to venous pressure difference. Transfer from alveoli blood to tissues, tissue blood partition coefficient, tissue blood flow, arterial to tissue pressure difference. Classification: only gas is nitrous oxide and xenon latest. Halogenated agents like isoflurane, halothane, sevoflurane, desflurane, methoxyflurane, enflurane. Methoxyflurane and enflurane not used now. Ether tried in older agents. First is nitrous oxide. Good analgesic but weak anesthetic. Least potent as MAC is high 104, not inflammable, lower water solubility and excreted by lungs, shows a concentration effect or second gas effect, can cause diffusion hypoxia. Then halothane, most potent in current use. It has a low blood gas solubility coefficient, that is 2.5, thus induction of anesthesia is relatively rapid. Halothane is a potent anesthetic but a relatively weak analgesic. It is potent bronchodilator. Halothane relaxes both skeletal and uterine muscle and can be used in obstetrics when uterine relaxation is indicated. Halothane is not hepatotoxic in children, but in hepatotoxic in adult in chronic use. Combined with its pleasant odor, it is suitable in pediatrics for inhalation induction, although sevoflurane is now the agent of choice. Causes bradycardia by suppressing SA node. Enflurane, MAC is 1.68%, potent cardiovascular depressant. Sweet and ethereal odor, generally do not sensitize the heart to catecholamines. Seizures occurs at deeper levels, contraindicated in epileptics. Caution in renal failure due to fluoride, not in current use. Isoflurane, colorless, volatile, liquid, pungent odor. MAC is 1.16%, least soluble of the modern inhalation agent. equilibrate more rapidly, induction rapid theoretically, that pungency causes cough and breath holding. Myocardial depression, coronary vasodilation, that is called coronary still syndrome, cardiovascular stability, muscle relaxation of chest in cardio. Sevoflurane, new drug, non-inflammable, pleasant smell, MAC 2% stable, low blood gas partition coefficient, faster equilibrium, non-irritant, so the fastest for induction. Does not sensitize the myocardium to catecholamines as much as halothane, does not result in carbon monoxide production with dry soda lime, produces compound with desiccated soda lime, more with barium lime, which is mostly nephrotoxic. Desflurane, MAC is 6%. It is delivered through special vaporizer called Omeda Tech 6. It is popular anesthetic for daycare surgery. Induction and recovery is fast. Cognitive and motor impairment are short-lived. It irritates all passages producing cough and laryngosome, not used in practice now. Special facts. Hypernatremia causes CNS excitation, thus increases MAC. Pregnancy decreases MAC because there is increase in progesterone level in pregnancy. Progesterone has sedative effect on brain. Age decreases MAC by 6% per decade. Acute alcohol intoxication produces sedation, thus decreases MAC. Methoxyflurane is mostly metabolized and produced more than 80 micromole per liter of fluoride in blood. The amount of fluoride ions produced by other methoxyflurane 50 micromole, sevoflurane 20 to 30 micromole, enflurane 20 micromole, isoflurane and desflurane 5. Global warming potential of anesthetic gases: nitrous oxide 289, isoflurane 1230 to 1401, sevoflurane 349 to 1980, desflurane 3714 maximum with desflurane. Desflurane is 17 times more potent than nitrous oxide. MAC value desflurane is 6.0. Xenon acts as NMDA receptor. Xenon has a very low blood gas solubility coefficient and so produces rapid induction of emergence from anesthesia. The disadvantage with xenon gas is its high density, which is much higher than oxygen and nitrous oxide, which leads to increased flow resistance and work of breathing. Thus, it is not suitable for patients with compromised respiratory function. It has minimal cardiovascular effects. It produces minimal cardiovascular depression and it is not arrhythmogenic and is safe in cardiac patient. Xenon produces no greenhouse effect or ozone depletion and is environmentally safe, unlike the other inhaled anesthetics. Other advantages of xenon are: does not trigger malignant hypothermia, non-explosive, has analgesic activity, reduces intraoperative opioid requirement.